Hello everyone, it's your favorite Sisters in Medicine, Anne-Marie here, and today I'm going to talk to you about some potential treatment options for COVID-19. Well, where do we even start? I'm sure you all have heard so many different agents being thrown around. I know I have, I've read about so many, but I'm going to share with you some of the 3 top drugs that I feel like have been tossed around in the news a lot. So what are we going to start with? Well, let's start with remdesivir. This is a common name that's being thrown around the households these days. Remdesivir is an investigational drug, and what that means is it's not currently commercially available. So what do we know about remdesivir? Well, there have been 3 trials that have looked at remdesivir to date that have some pretty interesting results. The first trial is in the Lancet journal, and this trial was from Wang and colleagues. This was a trial out of China. And what this trial essentially showed is that there was no difference between remdesivir and placebo. Huh? Where does that leave us? Well, that's where Gilead comes in. They did a trial comparing 5 days of remdesivir to 10 days of remdesivir. And what did they find out? Well, they found out that both a 5 and a 10-day regimen had similar rates of recovery. So essentially, you could be treated with remdesivir for 5 days and you could get the same treatment outcome as a 10-day regimen of remdesivir. Then the NIH, headed by Dr. Fauci, my favorite ID guy, they did a trial as well. And this trial was comparing remdesivir to placebo. And what they found was that with remdesivir, patients had a shorter time to recovery. I think it was 10 days with remdesivir versus 15 days with placebo. So what does that tell us? Remdesivir can shorten our recovery time. This is great news, guys. There might be a light at the end of this COVID tunnel. Anyways, now that we know we have a potential treatment option, what's the dose we should use? Are there adverse effects we should be afraid of? Well, I'll let you know that right now. So the dose currently being used in all these trials is an IV dose. So remdesivir only comes intravenously. You can't take it orally. And what they're doing is 200 milligrams of remdesivir on the first day, and then for the 4 days after that, we're doing 100 milligrams IV daily. That is the dose we use for remdesivir currently, and you let me know if you heard something else, because I don't think there's anything else to know. Lastly, what adverse effects can remdesivir cause? Well, currently, we don't really know because we're still studying it, but early results from trials have shown that it can affect your liver function and essentially elevate certain or increase certain markers in your liver that you do not want increased. So you definitely want to watch out if you have any prior liver disease. So right now, remdesivir is looking like our best bet, but I'm really excited to see the full results of those trials and see if they actually had an effect on mortality or keeping patients from dying. The next agent I'd like to talk to you guys about is favipiravir. Try saying that 5 times fast. This agent is actually already commercially available, and it's actually licensed in China to be used for the flu. Interesting, huh? So right now, favipiravir is another agent being looked at to treat COVID-19. We've had a few trials that have come out for it. They've been mostly small, and the reason why we don't like that is because you want larger trials with thousands of people to test out a drug, because that's how you know you're really and truly seeing a benefit if there is one to be seen. So the small trials that we've looked at so far, data, as you can see, I'm not convinced yet, but I could be convinced with more trials. Right now, it looks like favipiravir may have a role treating mild COVID as opposed to remdesivir, which is for more severe cases. Favipiravir would be for someone who, comes into the hospital, doesn't really have that many issues breathing, can still take oral medications because favipiravir is a medication taken orally as opposed to remdesivir, which was IV only, and a patient who you don't expect to really decompensate or get too ill too quickly. The dose that's being used for favipiravir right now, see, I even have trouble saying it. The dose being used for favipiravir is 1,600 milligrams twice daily on day 1, then 1,000 milligrams twice daily on days 2 to 14. And this is just one dosing regimen. There are a lot of different doses that are being looked out there for efficacy or to see if it works essentially. So this is a dose that we currently use where I practice. In terms of side effects or adverse effects for favipiravir, it's pretty well tolerated and people usually don't have any issues with it. However, it can cause birth defects, or at least that's what the animal studies showed. So right now we are not recommending it for any pregnant woman. Other than that, there aren't too many side effects you need to worry about, but of course everyone is different and you can present with different things. So right now, if you ask me what my opinion is on favipiravir, well, I want to see some more studies before I make a real recommendation. But I think, for mild COVID, it could have a role. We'll have to see. The next agent I'd like to talk about is hydroxychloroquine. And now I'm sure all of you have heard about this agent. It's usually used for malaria, so an anti-malarial agent, but I think we all know someone who was touting it a bit and talking it up a lot.
What do you have to lose? I'll say it again. What do you have to lose? Take it.
We don't have to go and name names. So hydroxychloroquine is also being looked at as a treatment for COVID. And there was a study that came out that got everyone in a frenzy about how great it was. This was a study out of France by Gautret and colleagues. You can go look it up if you're really interested in reading about it. So this study showed that a combination of hydroxychloroquine and azithromycin, which is an antibiotic used for bacterial infections, completely cleared the COVID-19 SARS-CoV-2 virus in 100% of the patients it was used in. Of note, there were only 6 patients that got the combo. So right there, you're already looking at a very small sample size. Additional studies have come out that have shown hydroxychloroquine reducing viral clearance, improving in patients, yada, yada, yada. As you can tell, I don't really believe it, because I've also read additional studies that have shown that hydroxychloroquine not only has significant side effects, it can cause heart arrhythmias, it also may increase mortality. Mortality equals death, so it can increase death. I don't know about this agent, guys. There's a lot of dosing regimens out there being used for it. I won't even get into it. As you can tell, I don't really believe in it. And there are a lot of studies currently continuing to look at it. I don't think it's very encouraging. I've read the data. I've read about 8 trials on this, and it's not very encouraging. But as you know, we need additional and larger studies before we can confirm anything. But I will put this out to all of you. Please do not ask your PCP, your primary care physician, to prescribe you hydroxychloroquine. The FDA actually released a warning, an alert about it because of these arrhythmias it's causing. They recommend it only in the context of a clinical trial while you're in the hospital being monitored. So for all you, my outpatient buddies, you don't need hydroxychloroquine. I don't think it works. I'm waiting on additional trials to confirm this, but if you ask me, my money's on no hydroxychloroquine for COVID.